Welcome to Pass Your Class CLEP Test Prep. I'm here today to guide you through some authentic human growth and development CLEP exam practice questions. At Pass Your Class, we've spent over a decade helping students successfully earn college credit through CLEP examinations, and we're thrilled to maintain an exceptional 98% pass rate among students who utilize our comprehensive study materials. In today's session, we'll examine challenging human growth and development questions that test your understanding of learning theories, psychological needs, developmental disorders, and early childhood communication patterns. Let's dive in. Underscore is when a variable from conditioning carries over to another related area. A. Stimulus generalization. B. Longitudinal research. C. Conditioning. D. Operant conditioning. E. Extinction. The correct answer is A. Stimulus generalization. Stimulus generalization is a fundamental concept in learning theory where a conditioned response occurs not only to the original stimulus, but also to other similar stimuli. For example, if a child is afraid of a specific dog after being bitten, they might develop fear of all dogs or even other four-legged animals. This psychological phenomenon explains how learned behaviors and responses can transfer from one situation to related situations. Understanding stimulus generalization is crucial in developmental psychology because it helps explain how children learn to apply knowledge and behaviors across different contexts, which is essential for cognitive development and social adaptation. Which of the following best describes self-actualization? A. To overcome loneliness and alienation, and to receive and give love. B. The need to understand and fulfill one's purpose or desire in life. C. The basic biological needs such as water, oxygen, and food. D. To have self-esteem and to receive praise and approval from others. E. The need to have a safe and secure environment. The correct answer is B. The need to understand and fulfill one's purpose or desire in life. Self-actualization is the highest level in Abraham Maslow's famous hierarchy of needs. It represents the human desire for self-fulfillment and the realization of one's full potential. According to Maslow, self-actualized individuals are motivated by personal growth, creativity, and the pursuit of meaningful goals rather than by deficiency needs like safety or esteem. This developmental concept suggests that once basic physiological, safety, love, and esteem needs are met, humans naturally strive to become the best version of themselves and to find meaning and purpose in their lives. Self-actualization is considered a lifelong developmental process rather than a destination. Ritalin is a well-known drug used to treat A. Habituation. B. Object permanence. C. Hyperactivity. D. Divergence. E. Convergence. The correct answer is C. Hyperactivity. Ritalin, generically known as methylphenidate, is a central nervous system stimulant commonly prescribed to treat attention deficit hyperactivity disorder in both children and adults. While it may seem counterintuitive to treat hyperactivity with a stimulant, Ritalin works by increasing dopamine and norepinephrine levels in the brain, which helps improve focus, attention, and impulse control. This medication has been extensively studied and is considered one of the most effective treatments for managing hyperactivity symptoms. Understanding ADHD and its treatments is important in developmental psychology because it affects learning, social relationships, and overall development throughout childhood and into adulthood. When a baby repeats things that it has heard, it is called A. Baby talk. B. Echolalia. C. Phonetic speech. D. Speech pattern. E. None of the above. The correct answer is B. Echolalia. Echolalia is the repetition of sounds, words, or phrases that a child has heard, and it's a normal part of language development in infants and toddlers. This phenomenon typically occurs between 18 months and 3 years of age as children learn to communicate. There are two types of echolalia. Immediate echolalia, where the child repeats something right after hearing it, and delayed echolalia, where they repeat something heard hours or days earlier. While echolalia is a natural developmental milestone that helps children practice language sounds and patterns, persistent echolalia beyond the typical age range may indicate developmental concerns and should be evaluated by professionals. Terrific job working through these human growth and development CLEP practice questions. You should now have a better sense of the material you'll encounter on the actual examination. Remember, these 4 questions represent only a small sample of the comprehensive content covered on the full CLEP exam. For complete preparation spanning all aspects of human development, from infancy through adulthood, including cognitive development, social psychology, learning theories, and developmental disorders, PassYourClass offers thorough study guides with extensive practice questions, detailed explanations, and study aids designed to help you master developmental concepts and research methods. Check out PassYourClass.com today to access your human growth and development CLEP study materials and join the impressive 98% of students who pass their CLEP exams using our proven preparation system. Thank you for joining us, and we're confident you'll excel on your CLEP journey.